Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
How to test pregnancy at home using baking soda. A very simple and doable test that can be done at home using a kitchen staple is the baking soda test. What is the baking soda pregnancy test? A baking soda pregnancy test is a simple at-home pregnancy test with baking soda tested with urine to determine pregnancy. The expecting mother needs to add a few drops of her morning urine to a spoonful of baking soda and check the acidity of the urine. If she is pregnant, she will notice some fizz. This is because baking soda or sodium bicarbonate reacts with most acids. Accuracy of the baking soda pregnancy test. The accuracy percentage for this test is 50%. The result is compromised because the acidity of the urine depends on several other parameters in the body. The acidity level changes each day depending on the food intake, water intake, etc., making it a very poor and loose indicator of pregnancy. How to perform this test? What you need: baking soda, 1 tablespoon. Urine, collected early in the morning or the first urine of the day. 2 sterilized containers. Clean surgical gloves. Method: wear gloves on thoroughly cleaned and dried hands. Collect some urine in a sterilized container. Pour a few milliliters of urine onto the baking soda in the container. How to get the best results out of baking soda pregnancy test? Conduct this test first thing in the morning with the first urine of the day. Drink heaps of water the night before to lessen the acidic level in the urine the next day. Wait for at least 15 to 20 minutes before you get results. How to interpret the test results? You will get a fizzy reaction immediately if you are pregnant. If not, the test indicates that you haven't conceived yet. Please note that the test is not 100% accurate. Therefore, it is always recommended that you go to a doctor to get an accurate result of your pregnancy.